Background: coming from middle class family, I completed my education till inter science and wanted to take admission to a medical course as per the desire of my parents. The marks were marginally less for me to take an admission to MBBS course. As an alternative, I took admission to BAMS. Very soon, I got frustrated due to the quality of education in the Ayurvedic college. I felt as if I am a victim of bad destiny. When suddenly a turning point arrived that changed everything. I had a talk with my guru Vaidya Madhav Kolhatkar for 1.5 hours. I met him for the first time and he influenced my life since then. I made a vow to dedicate my life to Ayurved and I am really happy to follow the path throughout my life. Once I supposed myself to be really very unfortunate for not getting admission to the MBBS course. But now I really feel fortunate in getting a chance to learn Ayurved. As per my guru's advice, I took up studies even in Sanskrit along with Ayurved and completed my MA with Sanskrit grammar along with BAMS. Later on, I completed MPhil in Sanskrit and MD and PhD in Ayurved. I was asked to go to various Ayurvedic practitioners for clinical experience. Vaidya S.D. Fansalkar, a disciple of Vaidya Gangadhar Shastri Gune, remained my main teacher. Vaidya Veni Madhav Shastri Joshi, Vaidya S.K. Karmarkar Nasik, Vaidya Datar Sangli and Vaidya Kolhatkar also created an impact on my clinical practices. Vaidya Kolhatkar was a real visionary in a very adverse situation. He could find out a way to educate the students, both theoretically as well as practically. As a result, after 25 years now, we have good practitioners of Ayurved to take up any challenge. We have good academicians, teachers, and good researchers as well. The Triskandha Kosha project as conceived by Vaidya Kolhatkar is really a historical landmark in the field of Ayurved. This is the first work of its own kind in this high-tech 21st century. It is the best method to explore the Ayurvedic texts in a very effective way to benefit all sectors such as academics, research, clinical practice, fundamental, etc. Computers were very new at that time and it was the vision of Vaidya Kolhatkar to use information technology to explore Ayurvedic texts. I left my full-time job in Ashtanga Ayurved Mahavidyalaya and joined the Triskandha Kosha project as an executive editor. The Department of Ayurved was new in Tilak Maharashtra University and we got engaged in the development of the department through various innovative courses. Suddenly, we got hit from the destiny on 6 November 1992. Our Guru Vaidya Kolhatkar passed away in an accident with no chance to treat at all. This was the biggest hit in my life, and I took merely 1 year to restore and make a vow to complete his work on Triskanda as a real homage to him. I had to struggle very hard to push the project without any funding and ultimately could get funding from government agencies and could complete the project in a total span of 19 years. Miss Meera Mehta, student of Iyengar Guruji, UK, Srimati Shanta Shastri, Secretary Ayush Department, and Dr. R.A. Mashelkar, Director General CSIR, helped me a lot to come out of this adverse situation. In the Triskandha Kosh project, we read each sentence from the original text, separated each word, classified and digitalized them in three databases, viz. Hetu Kosh, 85,000 records, exploring the cause-effect relationship of health diseases and their causes. Lakshana Kosh, 85,000 records, exploring the health or diseases and symptoms relationship. And Aushadha Kosh, 3 lakh records, exploring the relationship between health diseases and treatment medicine. This whole project has resulted in printed version of Hetu Kosh 3200 pages in 3 volumes, Lakshana Kosh 3200 pages in 3 volumes and Aushadha Kosh 8000 pages in 7 volumes. Ayuta, Nidana, Ayurvedic diagnostic software based on Hetu Kosh and Lakshana Kosh and Ayut Upchar Ayurvedic treatment software based on Aushadh Kosh. I have been honored at the hands of the Chief Minister of Maharashtra State and Vice President of India. The project is very much useful for researchers, practitioners, academicians and students of Ayurved as a ready recon exploring the major texts of Ayurved without missing a single reference. I could then realize the power of information technology as a tool to be beneficial to the field of Ayurved. Besides this project, I was practicing and enriching my clinical experience, especially in the field of cancer, heart disease and diabetes. 2 experiences made an impact in my life and suggested innovative ideas in the field of clinical practices of Ayurved. One of our students approached me to seek guidance whether we can help a terminally ill patient suffering from an advanced state of cancer. It was October 1985 when a 67-year-old man suffering from cholangiocarcinoma was opened up for a possible surgery and was left unoperated with no ray of hope of survival for more than 15 days. I decided at least to try to help him. I took guidance from Vaidya and started the treatment. It was a miraculous recovery and patient is still alive after 25 years with current age of 92. This case started fetching me many cancer cases, especially in advanced stage. To my surprise, those left untreated responded very well. Those who had undergone surgery, chemo, radiation had a limited scope of improving life quality and extending it to a certain extent. I am still doing the job for the benefit of the patients and the society. At least I could improve life quality in most of the cases, but still was not satisfied with the job and wanted to do more positive for the benefit of the patients. The same experience I had in heart diseases as well. People turn towards Ayurved when modern medicine cannot offer any treatment, especially when bypass surgery or angioplasty is not possible due to poor economic condition or fear of the procedure or the general condition of the patient not being fit for operation, or LVEF is too low. The patients turn towards Ayurved as an alternative system. Truly speaking, Ayurved can perform a much better job than modern medicine from the early stage of the disease till the advanced stages. I started getting the cases in advanced stages and realized miracles of Ayurved with its holistic management. I was very disturbed when I started getting cases of kidney failure either due to diabetes, hypertension, or both. The modern approach here is very mechanical. It is getting the work of kidney done by a machine, which is a process of hemodialysis to be performed twice or thrice a week for lifelong. Even the alternative of a kidney transplant is too expensive and risky. Moreover, since this is not a treatment for a cure, it is a prolongation of life artificially. People started coming to me mostly when they have already started dialysis. It is too late then. But later, people started coming to me in earlier stages, such as creatinine ranging between 2 to 4 and urea up to 100. It, it was a pleasant surprise that we could diagnose each case in Ayurvedic perspective and could reduce the creatinine and urea, or at least could maintain it to delay the commencement of dialysis. This is a very good achievement because CRF is a progressive disorder and irreversible in modern medicine. Based on my clinical experience in case of cancer, heart disease and diabetes, along with its complications, and based on the Triskandha Kosh project, I had an innovative idea to spread the knowledge through the internet. The idea struck my mind due to an experience in Germany. A young lady of 22 years age approached me for lifestyle consultation. She was suffering from malignant melanoma stage 4. She had already completed 3 cycles of chemotherapy and was due for the 4th one. When I noted her lifestyle, I was really shocked. She used to get up at 11 a.m. Her lunch time was 5 p.m. Dinner at 12 p.m. She used to watch TV till 3 a.m. and then sleep. Moreover, she was smoking 30 cigarettes a day. With this lifestyle, there are absolutely no chances for survival, I said to her. She was severely constipated, no appetite, no energy. She assured me to follow my instructions. I asked her to go to bed and wake up early, start yoga practice, eat figs and raisins to relieve constipation, drink milk separately, get de-addicted immediately. She followed my advice and we had a follow-up after only 8 days. I stayed only 10 days there. She was better. Constipation was relieved. She started feeling hungry and energy improved. Moreover, she left smoking. I asked her to continue the same regime. I visited Germany next year and she came for a follow-up. She had maintained health. Really surprising fact was that she didn't require chemotherapy for the whole year. I was encouraged and asked her to continue. The same experience repeat even next year. Only a change in lifestyle could keep her away from chemotherapy. I then decided to spread the message through the internet for the benefit of the global community. As a result, I developed the website www.gadgilayurved.com. It was released at the auspicious hands of Dr. R. A. Mashelkar, a well-known veteran Indian scientist. With this background of mine, let us explore the concept behind this website and create a healthy society.